Welcome to today's pharmacology quiz on oral antidiabetic agents. In this video, we'll test your knowledge of the drugs used to manage type 2 diabetes mellitus. The quiz consists of 10 multiple-choice scenario-based questions. Each question will include 5 answer options, followed by the correct answer and a clear explanation. There is also a companion teaching video with a comprehensive review of oral antidiabetic agents, and you'll find its link in the description. So, let's get right into it. Question 1. Mr. Anderson, a 58-year-old man with type 2 diabetes for the past 8 years, presents for routine review. He has a history of hypertension controlled with amlodipine. His HbA1c remains at 8.9%, with a target of less than 7%. He is currently on metformin 1000 mg twice daily, along with dietary modification. The physician considers adding another oral antidiabetic. Which of the following oral agents works primarily by increasing insulin secretion from pancreatic beta cells? Option A, glipizide. Option B, pioglitazone. Option C, acarbose. Option D, metformin. Option E, sitagliptin. The correct answer is option A, glipizide. The explanation is that glipizide is a sulfonylurea that works by directly stimulating insulin release from pancreatic beta cells. This increases circulating insulin levels, thereby lowering blood glucose. Other options act differently. Metformin reduces hepatic glucose production, acarbose delays carbohydrate absorption, pioglitazone improves insulin sensitivity, and sitagliptin prolongs incretin action. Thus, only glipizide fits the mechanism described in the question. Question 2. Mrs. Thompson, a 62-year-old woman with type 2 diabetes, is being reviewed after starting pioglitazone 3 months ago. She complains of ankle swelling and mild shortness of breath. Her past history includes congestive heart failure and osteoarthritis. Her HbA1c has improved from 9% to 7.5%. Which of the following statements about thiazolidinediones is correct except one? Option A, they improve insulin sensitivity in adipose tissue and muscle. Option B, they are contraindicated in heart failure patients. Option C, they may cause weight gain and edema. Option D, they directly stimulate insulin release from beta cells. Option E, they act via PPAR gamma nuclear receptor activation. The correct answer is option D, they directly stimulate insulin release from beta cells. The explanation is that thiazolidinediones, such as pioglitazone, do not directly stimulate insulin secretion. Instead, they act by activating the PPAR gamma receptor, improving insulin sensitivity in muscle and adipose tissue. These drugs are contraindicated in heart failure because of fluid retention, and they commonly cause weight gain and edema. Therefore, the only incorrect statement is that they directly stimulate insulin release. Question 3. Mr. Johnson, a 45-year-old man, presents with polyuria and fatigue. He has type 2 diabetes and was recently started on glyburide. He also takes aspirin daily. He now reports confusion and sweating. His fasting blood glucose is 45 mg per deciliter, where the normal range is 70 to 110. Which mechanism best explains his current episode of hypoglycemia? Option A, enhanced renal excretion of glucose. Option B, reduced hepatic gluconeogenesis. Option C, prolonged stimulation of pancreatic insulin release. Option D, inhibition of intestinal glucose absorption. Option E, increased insulin degradation in the liver. The correct answer is option C, prolonged stimulation of pancreatic insulin release. The explanation is that glyburide is a sulfonylurea, which causes persistent stimulation of pancreatic beta cells to release insulin. This prolonged effect can result in severe hypoglycemia, especially when combined with drugs like aspirin that may potentiate the hypoglycemic effect. The other mechanisms listed, such as inhibiting intestinal glucose absorption or increasing renal excretion, belong to other drug classes. Therefore, prolonged stimulation of insulin release is the most accurate explanation. Question 4. Mr. Williams, a 67-year-old man with type 2 diabetes and chronic kidney disease, with an eGFR of 28 milliliters per minute per 1.73 square meters, is reviewed in clinic. He has been on metformin for 5 years with good control. His physician is concerned about an adverse effect associated with this drug in renal impairment. Which of the following is the most important risk in this scenario? Option A, hypokalemia. Option B, lactic acidosis. Option C, hypoglycemia. Option D, hepatic cirrhosis. Option E, hypertension. The correct answer is option B, lactic acidosis. The explanation is that metformin is contraindicated in severe renal impairment because it increases the risk of lactic acidosis. Reduced clearance in chronic kidney disease allows the drug to accumulate, leading to higher lactate levels in the body. Unlike sulfonylureas, metformin does not cause hypoglycemia, and it is not directly linked to hypokalemia or hepatic cirrhosis. Lactic acidosis remains the most serious and potentially life-threatening complication in this scenario. Question 5. Mrs. Clark, a 70-year-old woman with poorly controlled diabetes, has coronary artery disease and hyperlipidemia. Her physician is considering adding an oral drug that increases endogenous GLP-1 activity and carries a low risk of hypoglycemia. Which of the following agents best matches this therapeutic property? Option A, repaglinide. Option B, sitagliptin. Option C, glibenclamide. Option D, pioglitazone. Option E, acarbose. The correct answer is option B, sitagliptin. The explanation is that sitagliptin is a DPP-4 inhibitor that increases endogenous GLP-1 activity by preventing its breakdown. This mechanism enhances insulin secretion in a glucose-dependent manner, which explains the low risk of hypoglycemia. In contrast, repaglinide and glibenclamide increase insulin release independent of glucose levels, raising hypoglycemia risk. Pioglitazone improves insulin sensitivity, and acarbose delays carbohydrate absorption, so neither matches the described therapeutic property. Question 6. Mr. Davis, a 64-year-old man with long-standing diabetes, is admitted with abdominal pain and nausea. He has been on sitagliptin for 2 years. His past history includes obesity and chronic alcohol use. Amylase and lipase levels are elevated, suggesting acute pancreatitis. Which of the following oral antidiabetics has also been associated with this adverse event? Option A, linagliptin. Option B, acarbose. Option C, metformin. Option D, pioglitazone. Option E, glipizide. The correct answer is option A, linagliptin. The explanation is that linagliptin, like sitagliptin, belongs to the DPP-4 inhibitor class, which has been linked to cases of acute pancreatitis. This rare but serious adverse effect is important to recognize in patients with abdominal pain and elevated pancreatic enzymes. Other drugs such as metformin, acarbose, pioglitazone, and glipizide are not strongly associated with pancreatitis. Therefore, linagliptin represents the agent most likely to share this adverse effect. Question 7. Mrs. Roberts, a 54-year-old woman with type 2 diabetes, obesity, and non-alcoholic fatty liver disease, presents for medication review. She is intolerant to metformin due to severe gastrointestinal upset. The physician wants to avoid drugs that promote weight gain or cause hepatotoxicity. Which of the following oral agents would be least appropriate in this patient? Option A, pioglitazone. Option B, sitagliptin. Option C, acarbose. Option D, dapagliflozin. Option E, glimepiride.
The correct answer is option A, pioglitazone.
The explanation is that pioglitazone, a thiazolidinedione, is associated with weight gain and potential hepatotoxicity, making it unsuitable for this patient with obesity and fatty liver disease. Sitagliptin, acarbose, and dapagliflozin are safer choices in this context because they do not promote weight gain.
Glypyride can cause hypoglycemia and weight gain, but pioglitazone is especially inappropriate due to its hepatic effects. Thus, avoiding pioglitazone is the most clinically relevant choice here. Question 8. Mr. Harris, a 72-year-old man with type 2 diabetes, has recurrent urinary tract infections. His eGFR is 65 milliliters per minute per 1.73 square meters. His current therapy includes dapagliflozin. Which of the following best explains the mechanism of action of SGLT2 inhibitors? Option A, inhibition of hepatic glucose production.
Option B, increased renal glucose reabsorption.
Option C, blockade of glucose reuptake in proximal tubules. Option D, enhancement of incretin hormone secretion. Option E, stimulation of pancreatic insulin release. The correct answer is option C, blockade of glucose reuptake in proximal tubules.
The explanation is that SGLT2 inhibitors such as dapagliflozin act in the proximal renal tubules to prevent glucose reabsorption.
This leads to increased urinary glucose excretion, lowering plasma glucose levels.
The downside of this mechanism is an increased risk of urinary and genital infections due to glycosuria. Other options represent mechanisms of different drug classes, making proximal tubular blockade the correct explanation.
Question 9.
Mrs. Miller, a 40-year-old woman with gestational diabetes, is concerned about the safety of oral agents during pregnancy.
Which of the following statements is correct except one?
Option A, metformin can be used under specialist supervision in pregnancy.
Option B, glyburide may be considered when insulin is not tolerated. Option C, pioglitazone is contraindicated during pregnancy. Option D, acarbose is recommended as first-line therapy in pregnancy. Option E, insulin remains the preferred drug in gestational diabetes. The correct answer is option D, acarbose is recommended as first-line therapy in pregnancy. The explanation is that insulin is the gold standard and preferred therapy for gestational diabetes. Metformin and glyburide may be used under specialist guidance in certain cases, while thiazolidinediones like pioglitazone are contraindicated. Acarbose is not recommended as first-line therapy in pregnancy, making this the incorrect statement.
Therefore, option D is the exception in this set of statements.
Question 10.
Mr. Brown, a 59-year-old man with type 2 diabetes uncontrolled on metformin, is being considered for a second agent. The physician compares the efficacy of sulfonylureas versus SGLT2 inhibitors. Which of the following is an advantage of SGLT2 inhibitors over sulfonylureas? Option A, lower risk of genital infections. Option B, increased risk of hypoglycemia. Option C, associated with weight reduction.
Option D, stimulate insulin secretion directly. Option E, contraindicated in heart failure. The correct answer is option C, associated with weight reduction. The explanation is that SGLT2 inhibitors promote urinary glucose loss, which often leads to modest weight reduction and improved metabolic outcomes. In contrast, sulfonylureas commonly cause weight gain and hypoglycemia due to direct insulin stimulation. While SGLT2 inhibitors increase the risk of genital infections, they are not contraindicated in heart failure and may even offer cardiovascular benefits. Thus, weight reduction is a key advantage of this class. Conclusion. That wraps up our revision on oral antidiabetics. I hope you found this quiz session engaging and informative. To deepen your knowledge further, consider reading resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF.
These references will solidify your understanding and enhance your preparation.